Hi, my name is Cynthia Carr. I'm an occupational therapist. Have been in the field for 35 years. I became aware of the profession when my mother, who worked as a supply attendant at a major hospital, passed by a room during her daily routine that was called occupational therapy, and she saw individuals working with children on a pediatric unit that were receiving therapy after surgery, after various injuries, and she would come home and share those stories with me. And I knew right from that point that that's what I wanted to do. I wanted to be an occupational therapist. My mind was pretty set at that point. So I was practicing as an occupational therapist in a major county facility for about 18 years. I then moved into academia, where I work as a faculty member teaching occupational therapy at Governor State University. What I do need to say is all my years working at the county facility, where we were getting referrals from clients from rheumatology, I did not get referrals with clients with vasculitis. I first became aware of vasculitis from the other side, from my husband, Philip Carr, hubby, who contracted GPA and was diagnosed last year, March of 2012. So I guess you could say, as an occupational therapist, I also was thinking about what his needs were. He did receive occupational therapy and physical therapy inpatient, but I was also a caregiver from the other side of trying to find out more about what was this diagnosis called vasculitis. We did have a rheumatologist we felt very confident in. He led me to the Vasculitis Foundation. First he said to Google Wegeners vasculitis, but later I did go to the Vasculitis Foundation, and that's where I got my wealth of information. I called the 800 number, and they sent me a whole packet of all the various types of vasculitis. We made a choice for Cytoxin IV. But again, it was nice to be given choice in terms of what information was out there. Going to some of the YouTubes on the Vasculitis Foundation site was also extremely beneficial, because there were other physicians that saw the diagnosis pretty bleakly. And I'm an eternal optimist, so the site helped me to see, yes, people are living with this diagnosis. Through getting the newsletter, I learned that there had been a vasculitis symposium in Chicago, which is where we live. And I probably wasn't ready at that time, so perhaps that was divine intervention that I did not attend the one in May. However, I was made aware of the one that was in Atlanta, Georgia, last summer of 2012. And I attended that, I think, more for myself, again, to learn more. I found, as I looked around me, the majority of the audience were people living with vasculitis. The information from the physicians was awesome. People were extremely loving, approachable. I felt like the first time I was with a family, of other individuals and family members going through the same things that I felt. So that impacted me. I also, though, observed people around me by noontime, lunchtime of a full day of sessions, kind of melting, fatigue, tiredness, but yet determined to stay there the whole day because this was their time to get information and to connect. So I felt from that point, okay, in any given situation, there's something good to come out of it, and I felt what came out of it, not only for me personally, but what I needed to give, and that was to do a session this year in Philadelphia on occupational therapy and how it could benefit individuals. I think it's probably a combination of both. The disease process itself and the medications and who we are as individuals, as occupational beings, that we're engaged in life, regardless of where we are in terms of our age, in terms of our jobs and other commitments, that we are all still trying to participate in life. And the disease process, as well as the medication, can start to impact that, our everyday routines, our activities of daily living, from the time we get up in the morning to the time we go to bed, and our roles and our responsibilities. it's not always easy to give up the things you love or the things that you feel are your responsibility that other individuals are expecting of you, and especially that you expect of yourself. So that's where looking at what is this individual, who is this individual, what's important to this individual, and from that, what things are you willing to delegate to others, or to say I won't be involved, but which things you definitely want to hold on to that are part of who you are. So that's where I believe we have to start in analyzing and assessing ourselves and knowing life goes on with the diagnoses, with the choice of medications that, prednisone as an example is considered terrible medicine, but if it's a life-saving for you to exist, then how do you live around that? How do you look at your time management? How do you look at conserving your energy? Key important techniques that people can learn. I think it starts with knowing where you are today, and that doesn't have to dictate where you will be tomorrow, next week, next year, and see how you can still participate. I've known individuals, for example, with spinal cord injury. One example is a gentleman who was a rodeo rider. So no, he was not going to go back to rodeo riding. However, what he found a door opening was he became the judge of the rodeo riders. And as many people will contest to, they can later start to reflect that their disease process in some ways have blessed them. And I don't think you could, I can't say I know what you feel or believe, but I can listen to your story and see how life has transitioned for whatever the condition may be. But we can still look at what you want to happen today. There are always goals. Short-term goals lead to long-term goals. And with perseverance, we all have used that in some form or shape in our life. We can still reach for our goals. I think your vasculitis newsletter about Mr. Robert Geismer is a perfect example of a gentleman who was told by some prominent physicians that he would never golf again. And he states that after 15 months of occupational therapy, he was back on the golf course. So no, he wasn't probably back on the golf course the very next day after therapy, but it was a goal he had, and it was the job of the occupational therapist to look at the skills that would be needed and that could be built upon. We believe in remediation. If there's muscle strength, if there's fine dexterity, the person needs to really work on gaining, as well as adaptations. That you can still perform some of the activities you love, your occupations, but you may do it in an adaptive manner with adaptive equipment or adaptive techniques. Well, what's key for us is we believe in being client and family centered, so we look at each individual as a unique occupational being. We start with an interview that provides a profile on that individual. And we may need to look at performance skills, their motor skills, their cognitive skills, psychological, social support skills. And from that profile, then we look at what performance areas they say they are currently having difficulty with, activities of daily living, homemaking, doing things for other individuals, pet care, care for other individuals, their jobs or careers, or going back to school. And then from that, we come up with a intervention. And again, the client, the family are to be a part of that. They tell us what their goals are. I don't tell you what your goal is. You inform me what your goals are. And that way we work towards those goals. And the intervention will be different for each individual depending on how the vasculitis presents itself. If it's decreased lung capacity, then we work on moderating as to knowing about their O2 sats, monitoring that before therapy, during therapy, after therapy, if it's cardiac manifestations. So again, the person gradually gets the just right challenge towards working towards their goals and the outcomes they want. Certainly with the fatigue as an issue or pain issues. We may also be working with, if they've been referred to, pain clinic, to know what's happening from that degree. We always want individuals to tell us subjectively, what is your scale on a pain of 0 to 10? And what can we do to decrease that? Interestingly, pain tends to decrease when the client's engaged in the occupations that are important to them. So if I'm just sitting, and as many times clients will talk about is at nighttime they have more severe pain, well, that's when you're laying there, there's nothing else, particularly on your mind, and you sense everything going on in your body. However, when you are engaged, whether it's washing dishes, cooking a meal, preparing for writing out checks to pay bills, whatever those occupations that are meaningful to you, we find that their report of pain actually decreases because they are engaged. And it's very important, psychosocial is a part of every person's life as to how they feel they are coping. If there are things we could work on that would be stress reduction, that also can decrease pain and anxiety.